It has become an all-too-familiar sight, ambulances queuing outside hospitals. Now the NHS has asked the London ambulance service to wait only 45 minutes before handing over patients to emergency departments so they can get the crews back on the road to answer the next call. NHS London said this was not a blanket order and that patients would only be left alone in emergency departments, even if no staff were immediately available, when it was clinically safe. But they said it was a sign of the record demand for urgent and emergency care. It's also a sign of the intense pressure that the NHS is under. 31,778 hours were lost in just 1/4 of last year in the capital alone, while paramedics waited for emergency department staff to be free. Across the country, the health service is facing what has been described as intolerable and unbearable strain. And this afternoon, after days of silence, the Health Secretary acknowledged the pressures.
We've seen significant pressure on the NHS, particularly over this period, through a combination of very high rates of flu, persistent and high levels of COVID, continuing concerns, particularly amongst many parents around strep A, and that has combined over that period with a time when primary care services and community services are also much more limited. So that surge in flu and COVID cases has put massive pressure in terms of the NHS services.
Over the Christmas-New Year period, a dozen trusts declared critical incidents with hospitals at capacity. One patient with flu and pneumonia described his wait of more than 24 hours in A&E before being found a bed on a ward.
But they had no beds anywhere in the hospital. And this is a big hospital. So I spent the night there, and the next day we all had a cheery session saying, yes, we found you a bed. So up I went and started to have the treatment proper.
The Department of Health said it has put in £14.1 billion additional funding for health and social care over the next 2 years, along with winter pressure funding. But the British Medical Association dismissed the Health Secretary's statement today.
The government response to the current winter pressures are not only inadequate, but they fail to take into account how serious and how systemic this problem is. We have winter pressures every year. We've got winter pressures that are all year round now. This is a situation that's been going on now for over 10 years and getting worse. The pandemic has made it worse than it otherwise might have been. But this comes on top of persistent and consistent reductions in funding and beds and staffing.
In the weeks ahead, more strikes are planned by nurses and paramedics, with warnings that the health service faces at least 3 months of what even the government admits is an unprecedented challenge.
Victoria MacDonald reporting there. Now, 4 out of 5 trains were cancelled today as 40,000 members of the RMT union started 5 days of industrial action with a 48-hour walkout across England, Scotland and Wales. Travellers were urged to avoid all but the most essential train travel, while there was also disruption on the roads as National Highways staff went on strike. With more stoppages planned across the public sector later this month, 2023 is really starting as it means to go on. From Bristol, Jane Death reports.
If ever there was a recipe for the January blues, a cold, wet morning and a long wait for a train will do it. It's a new year, but the rail strikes are back.
And they're back with a vengeance, with the RMT action today and tomorrow, as well as Friday and Saturday, as well as a walkout by members of ASLEF, the train drivers' union, on Thursday. It all adds up to 5 consecutive days of disruption.
But the train companies and Network Rail say a deal on pay, jobs and conditions could be just round the corner.
We are very close to a deal. In fact, with the RMT, we had 2 weeks just before Christmas where we got very, very close.
So if you got very close, what went wrong?
We need to make sure that we've got a sensible pay rise, percentage-wise, for colleagues across the rail industry. That needs to be paid for with a sensible set of reforms. And at the same time, we need to make sure that we're not taking any more than our fair share from the taxpayer. So we've got to get that balance right. It's not quite right there yet at the moment.
The government says it's facilitating negotiations, but the RMT boss says Transport Secretary Mark Harper is blocking a deal.
He's got to give a mandate to the companies, Network Rail and the train operators, that will settle this dispute. Those managers, the executives at that level, know exactly what needs to be done, and they're not allowed to produce a document and a set of proposals that would resolve it.
The government denied it had been obstructive.
But actually, ongoing conversations have taken place between the rail minister, the trade unions and the employers across the whole Christmas period. And as I said, it's very disappointing these strikes are taking place. They're damaging the rail industry, they're damaging the interests of the people that work in it, as well as being incredibly inconvenient to passengers.
Some of those passengers in Bristol told us they still support the strikes.
My journey was fine, but I don't know if how I'm going to get home, because I don't think there'll be many trains this evening. So it's very frustrating, but I do have sympathy for them.
Has your support for the strikes stayed strong as we go into another year? Because they started back in the summer.
Absolutely, yeah, 100%, because I think what the railway strikers are doing, more of us should be doing.
But there were others whose patience has reached its limit.
It's New Year. It's been a tough Christmas for everybody as well with all the strikes, and they're not stopping. There's 4 or 5 days in a row now.
And this is just the start of a new season of strikes across the public sector too, something this expert in industrial relations thinks will bring real pressure to bear on the government.
So we have a sense of troubles piling up, and I think probably pressure intensifying from business to sort out the strikes and the disruption that they're causing. You know, it's very worrying when you hear on the radio of people who need health services not being able to access them or being... We do have a sense of a crisis building up, which I think is bound to cause political pressure.
The government's pursuing new legislation around future strikes, but says this one can be resolved. Fresh talks are expected next week.
Jane Death there. Well, I've been asking the Work and Pensions Secretary Mel Stride about both strikes and the NHS crisis as part of a pooled interview for all broadcasters. He was announcing a new £900 cost of living payment for people who are on means-tested benefits, with extra cash for disabled people and pensioners. I asked him if he accepted that wouldn't cover record energy bill increases at a time of shrinking pay packets, higher mortgage payments and tax rises.
The government's priority, and I think this is absolutely right, is to focus on the most vulnerable in our society. So that £900, for example, is just part of a larger package that will be there to support just those people through the next 12 months. So the £900 will be paid to 8 million low-income households in 3 tranches starting this spring and ending in the spring of next year. There'll be £150 for 6 million disabled people. There'll be a £300 payment for around 11 million pensioners this coming winter on top of their winter fuel payment. So there's a lot that we're doing. And of course, then there's the energy price guarantee, making sure that for the average bill payer, those fuel payments, those energy costs don't rise by more than £500.
This is all against the backdrop of a very bleak new year, in particular the NHS crisis. The Royal College of Emergency Medicine says that you're in denial, you, the government, are in denial about the extent of the problem. Do you accept there is a crisis and it is costing lives?
There are major challenges at the moment, and we've seen that in recent news in terms of the backlogs, etc. Much of this, of course, caused by the fact that we have been through this extraordinary pandemic, which has made things much more difficult, both in terms of perhaps people that haven't been coming forward previously with conditions who are now doing so. But the important thing here is, I think, firstly, that the government has prioritised the NHS and our social care sector. So a lot more money, £8 billion actually over the next 3 years, being put in and announced by the Chancellor recently.
But there are people waiting days on trolleys. There are ambulances queued up outside hospitals. ITV News has a leaked email saying that London Ambulance Service crews will now only wait 45 minutes at hospitals before handing over patients. So there's going to be even more patients waiting on trolleys. Do you accept this is a crisis?
Well, I do accept that we need to make progress, and that's why I'm pointing. Well, whatever one terms it, it's obviously we want to be in a better position than we are at the moment.
There's a fresh round of NHS strikes due. The BMA says that the situation is intolerable. They say they've repeatedly invited the government to sit down and talk about the pressures that the NHS is going through, and that your silence on this is deafening, to quote them. Doesn't the same apply to industrial action, whether it's in the health service or in the rail service? You're not sitting down and trying to get a deal.
I don't accept that we haven't been engaged in that sense, or indeed subsequently where meetings have been held between ministers and unions. But the fundamental problem here, Cathy, is that the level of increase that's being sought, and you mentioned the nurses, we have huge sympathy for nurses, do an extraordinary job day in, day out, tirelessly up and down the country. But nonetheless, to be seeking 19.2%, which is 5% above a level of inflation that is now falling,
but
I'm afraid is unaffordable.
They're prepared to budge on that figure if you sit down and talk to them about pay. Is it the time to do that now?
The more general point here, though, is that we have to have pay restraint across the public sector.
I want to ask you about the rail strikes today. The RMT boss, Mick Lynch, has said that those strikes will go on into the summer simply because ministers have torpedoed a deal.
No, not at all. These are negotiations that the government has facilitated at every turn. They are negotiations between the employers and Network Rail, etc., and the unions. Two of the unions, the TSSA and Unite, have actually already settled on precisely the terms that are on the table for the RMT. And I think it's, I would urge the RMT to now do the right thing and settle. There must be question marks now over the future of the railways, how prosperous they can be in a situation where wages they're pushing for ever higher wages, and yet the number of users of our railways has been dropping. And that's dropped by 20% or 40% when it comes to commuters. So, it's a tough situation, and we need pay restraint to be part of the solution.
If the rail unions call off their strikes now, would you call off your anti-strikes legislation?
We do have to question whether we've got the balance right between the right of workers to strike and the inconvenience and sometimes danger that can pose to the public. So I think it's quite right that the government has come forward and already introduced some legislation, and we will come forward with further details in due course.
Right, and you'll beef that up. The longer these strikes go on, the tougher that legislation gets.
Well, I'm not sure I'd phrase it quite like that, but I think the way I would phrase it is to say that as the strikes are progressing, government is very clearly looking very closely at the implications of those strikes and maybe the kind of legislative changes that might be appropriate given what we're learning. And as I say, there has to be this balance between the right to strike on the one hand, which is absolutely right, but equally the inconvenience and sometimes danger to the public that results.